From the Biomedical Imaging Center at Northeastern University in Boston. My name is Francesca and I'm part of the Penn Lab that is run by Susan Whitfield Gabrielli. The ultimate mission of our lab is to quote-unquote look inside the box. We look inside the box of the brain basis of psychiatric disorders and try to promote the translation of this knowledge into the clinical practice. Towards this end, we use neuroimaging techniques to discover biomarkers. So we do this in order to improve the diagnostic process, to improve early detection, and to develop novel therapeutic techniques such as real-time fMRI feedback. In addition, we also work towards precision medicine to improve the prediction of treatment response. So for example, we use information about resting state networks to predict response to cognitive behavioral therapy or CBT. This is particularly a relevant point for clinical practice because being able to exploit the characteristics of an individual to guide them to their optimal available treatment can increase the success rate, can prevent dropout, and overall save the patient's energy, which should instead be used in their recovery process. For example, Susan and some of her colleagues conducted a study in which a group of people suffering from social anxiety disorder underwent 12 weeks of CBT. Using magnetic resonance imaging, they gathered information about both structural and functional connectivity of the brain, on top of measures of symptom severity. As now many other studies did, it was found that CBT was effective in improving their symptoms, with more severe symptoms pre-treatment exhibiting greater gains after CBT. But most importantly, these patterns of improvement were accounted for in their model. They found that the measures of brain connectivity that were gathered before the participants even started doing CBT inform of how much their symptoms were going to improve after CBT. It is not to be forgotten that the self-report scores alone were also predictive of symptoms change after CBT. But by combining self-report scores, structural and functional measures of intrinsic connectivity, the prediction was 5 times better than self-report alone. So overall, these results strengthen our hope that we will get to a point when patients who come into a clinic are suggested to follow a treatment based on their own characteristics and with an accurate prediction of success. Now, a growing number of research groups are finding similar results and are moving in this direction towards precision medicine. So our hope is that this box will continue to be better understood in the future. Thank you.